Should we be continuing compressions during defibrillation? Like not even stop. We just keep pumping on the chest during the delivery of that energy? No. There is a school of thought that says we should be doing this. I think it's a fool's errand, and I'm going to get into why. So the first thing that we would need to address is why would we want to do this? And for those that advocate for this practice, it is to avoid unnecessary pauses and compression. There is some data that suggests that when you stop compressions, after 3 seconds, all of your intrathoracic pressures drop to zero, and it takes at least 15, 16, maybe even up to 20 seconds to regain all that intrathoracic pressure. So one pause in compressions can cost you up to like 30 seconds of actual coronary perfusion. But what we have to acknowledge is that, number one, this was based on animal data. And number two, we have recent data that suggests that those intrathoracic pressures are actually maintained for much longer than we think when compressions are paused. This is also an opportunity, if you're performing manual compressions, to swap compressors, which we want to do every 2 minutes. We don't want heroes performing multiple cycles of compressions in a row. I don't care how good a shape you're in. After 2 minutes, get out and let fresh arms get in. So, would keeping hands on during defibrillation be safe for the provider? Let's talk first about incidental shocks to the provider during a defibrillation. Incidental shocks to a provider during a defibrillation occur, according to the data, between every 1 to 1,000 and 1 to 1,700 defibrillations. And there are no documented cases of serious injury or a lethal dysrhythmia occurring from that incidental contact. The overwhelming majority of cases are just a tingling sensation or a small burn. There's also the question as to whether nitrile gloves offer adequate protection from the energy delivered by a defibrillator. Some data says that it does not offer adequate protection. There's some data that says that it offers 99% protection. Now, as far as data observing this practice, there have been smaller observational studies that have used lower amounts of energy on cadavers. And the outcome of the study was that the only people that reported feeling anything were in the group that did not receive any energy during the defibrillation. Here's what I think speaks to this issue the most. You're asking people to go against their survival instinct. That is a tall ask. It is an unethical ask, and I think that's where this practice dies, is in that discussion. This does, however, beg the question, what about mechanical CPR? What about keeping the Lucas or the autopulse ongoing during a defibrillation? Doing that and performing manual compressions during a defibrillation both rely on one thing: the accuracy of the technology that's looking at the actual underlying rhythm during defibrillations. We will talk about that in an upcoming video.